Today I will tell you how to do CPR for a child less than 1 year of age. If you notice a child is non-responsive or a child collapses in front of you, then you immediately check first that if the child is actually unconscious. You go near the child, tap the child's shoulder, tap the child's leg and see if the child is showing any response. If there is no response or the child is not breathing, then next thing you check for the child's pulse. In babies less than 1 year, pulse should be checked in the arm for the brachial pulse. So I'll just turn the baby to show you more clearly. So in between the elbow and the shoulder, you keep your two fingers in the inner side of the arm. Here you will feel the brachial pulse. If you don't feel a pulse in 10 seconds, that means you have to start CPR. These days everybody has mobile phones. Immediately call someone, put it on speaker, ask them to call for an ambulance, call someone for help. In the meantime, if you are alone, you identify the two nipples of the child. An imaginary line joining the two nipples just below it on the center part of the chest. You have to give the child chest compressions. If you are alone, then we use the two finger technique. You compress the child's chest. If you are alone, you have to do it 30 times. So, and the pressure should be so much that the chest of the child goes down by 1.5 inches or around 1/3 of the child's chest. So, we will give it 30 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Like that. Once you are done giving the chest compressions, then you go to the child's head side, gently tilt the child's chin, lift the child's chin like that and tilt the head like that. This will open the airway and make it easier for you to give a breath. If it is a case of accident or some kind of head injury, then don't move the child's head. So you squeeze the child's nose closed and you give a breathing into the child's mouth. 1, 2. Like that you give 2 breaths. And then you again start with your chest compressions. 30 chest compressions, 2 breaths. Now in the meantime, if somebody comes for help, then one of you should stand on one side to give breaths and the other person should come and stand here to give more effective chest compressions. So if 2 of you are here, the second person will circle the child's chest like this tightly. I just turned the child to demonstrate. And same place below the lines joining the nipple, you place your 2 thumbs like this, one on top of the other, and you give pressure. Now once 2 people are there, the ratio will be 15 compressions and 2 breaths. And you keep continuing like that. If one person gets tired, the other person can take over compressions and the other person can give breaths. So this is how you do CPR for a small child.